Great. Hi, everyone, and welcome to today's webinar from BioInformatics, Perceptions of Artificial Intelligence in the Life Sciences. I'm Keely Truhl, and I'm the Senior Marketing Manager for Science and Medicine Group. Before we get started, I wanted to cover just a few housekeeping items with you guys. So first of all, if you experience any issues throughout the broadcast, please feel free to put those in the chat, and I'll do my best to work with you to fix those. Second, this presentation will be available for on demand after the webinar is concluded, and an email will be sent to all of you with the information on how to access that. Finally, we will be taking time to answer questions at the end of the broadcast, so please submit those in the Q&A at any point during the presentation. I'll collect those and we'll moderate that at the end of the presentation. Leading us in today's discussion here, we have Danny Wu. She's the Manager of Scientific Advisory Services for Science and Medicine Group. So at this time, I'm going to pass that over to her. Danny, thank you so much for joining us today.
Thanks for the introduction, Keely. So thank you everyone for joining us today. Today we'll really just be walking through select highlights for our report, our latest title, Perceptions of Artificial Intelligence in the Life Sciences, where we try to explore current sentiments towards artificial intelligence and understand and delve a little bit more deeply into how it's currently being utilized in research workflows. So just a quick overview of the topics we'll be discussing today. We'll give an introduction about bioinformatics and Science and Medicine Group, the study overview and objectives, what we're hoping to accomplish with this report, as well as the methodology and the approach we took for this study. We'll also give a brief highlights of the sample composition and who the participants were in the study, key highlights, and focus on three particular topics: usage and perceptions of artificial intelligence, AI integration and life science workflows, as well as willingness to pay and barriers to adoption for artificial intelligence. So just quickly about bioinformatics, we are a full service market research company that offers a variety of products and services that enable our clients to see themselves, their products and services, their markets, and their competitors, specifically through the lens of their customers and markets. In particular, we specialize in quantitative and qualitative market research in the life science industry. This report is one of several titles on our slate this year that is really focused on understanding new trends within the life sciences space. So for example, other recent titles include focusing on the impact of sustainability, as well as new frontiers in synthetic biology. But for today, we'll really be focusing on artificial intelligence. So bioinformatics initiated a market research study to better understand the perceptions and usage of AI in the life sciences. There were four core objectives that we sought to explore in the study. Number one is just to gather the general sentiment towards AI. Number two, understand the research applications in which AI is most commonly used and where there is an unmet need for AI. Thirdly, the goal was to determine barriers and motivators to adoption of AI into current life science workflows. And finally, identify key organizations that are developing AI or actively employing AI in their workflows. Today's presentation will really be focused around these top three objectives, and we'll be walking through some of the main takeaways there. In order to achieve these goals, bioinformatics designed an online quantitative survey that contained 41 questions and took a median time of about 10 minutes to complete. It was fielded to 411 respondents, primarily members of the Science Advisory Board, which is a segment of the scientific community who has demonstrated willingness to participate in market research activities. The qualification criteria for this study was quite broad, but in brief, they had to work in academic or government research settings or industry. So for example, biopharma, biotech, contract research organizations. It was a global study and spanned North America, Europe, and Asia Pacific, although the survey was fielded in English. A summary of the results will be presented in this report. So some highlights for the sample composition for the study. As I mentioned, it was a global study and was evenly distributed between North America and Europe, and we also had a 25% representation from Asia Pacific. This is just a highlight of the countries that were represented, including the US, Canada, United Kingdom, Spain, India, Japan, and China. The data was primarily segmented into 3 key cohorts based on current usage of artificial intelligence for work-related tasks. These 3 segments, you'll hear me reference them throughout today's talk, include current AI users, future AI users, either within the next 12 months or greater than 12 months, as well as no intent to use, who these respondents will call them skeptics. These 3 groups span across different types of market segments, as well as organization types and job titles. Most of these respondents identify themselves as lab managers, directors, principal investigators, and staff scientists. Interestingly, we also explored generation. It was pretty evenly distributed, although it did skew towards a little bit older demographics for the skeptics cohort. So a quick summary of the takeaways we'll be talking through in this webinar today. What we found is that artificial intelligence is viewed through an optimistic, though hesitant lens overall. Key perceptions of AI indicate that respondents really associate it with the future. It's highly useful, it's innovative, and it can drive efficiency in their work settings. Nevertheless, this excitement is paired with concerns and hesitancy about the complexity and scariness of AI, and we'll delve into what those concerns are. In terms of core benefits, respondents highlighted increased data processing power, speed, time savings, and valuable data insights as the core benefits of using AI in life science research settings. Data validity, however, is a key concern for using AI. Secondary concerns include lack of organizational infrastructure for the implementation of AI, the cost of AI, cybersecurity, and the lack of relevant solutions to meet current needs, meaning that they really need some application-specific tailored solutions for their work that just doesn't exist in the market right now and could be a potential opportunity in the future. In terms of integration into life science workflows, current users expect to apply AI to up to 49% of their research applications, indicating that they're prepared to utilize AI for a breadth of different tasks. Some of these tasks include the processing of large data sets, identifying trends via pattern recognition, analyzing and characterizing images, as well as predictive modeling. And these would be considered the most high impact methods to utilize AI in their work. There are a few commercial options available on the market, and current users indicate that they're willing to pay for these solutions, but it's really highly dependent on the applications. In this study, we found that drug discovery, molecular biology, and analytical chemistry applications are the top applications of interest to have AI solutions available. Google, Microsoft, IBM are the top of mind providers of AI solutions, and they are considered global leaders. They may be first considered for commercial solutions, but there is space for a number of tailored options for their applications in the future. So let's talk through first the usage and perceptions of AI. So artificial intelligence is used in both personal and professional settings. It might actually be used more frequently in personal settings. And in personal settings, we reference examples such as navigation systems, search engines, streaming recommendations, and algorithms like such. And they tend to be used within their daily lives. In terms of AI usage for work-related settings, it's used less frequently, but nevertheless, current users indicate that they utilize AI to perform at least 26% of their work, meaning that respondents who are currently using AI have embraced it across their workflows. And here you can see how we segmented for current users, future users, and skeptics. Even future users who might not be employing AI in their work are still using it for personal tasks. on a semi-regular basis, although not to the same extent as current users. In general, respondents have pretty positive perceptions of AIs. Current users have more positive perceptions of AI than non-users. So this data was segmented by personal tasks as well as work-related tasks. Respondents were asked to evaluate what they perceive the impact of AI is to have on their lives within these two tasks, whether they view it very positively, neutral, negatively, or very negatively. And as you can see, there is a trend that we see that current users, future users, most of them have somewhat positive perceptions of the AI, although there is a strong neutral cohort as well. Skeptics, nevertheless, are much more neutral, and there are a few of them who indicate that they have negative perceptions as well. We also explored what these sentiments were top of mind. So these are unaided feelings towards AI in the life sciences. And here is just a word cloud of what their initial feelings are towards AI for current users, future users, and skeptics. And as we can see, perceptions of AI are generally positive, though they are paired with those concerns about complexity and scariness that I had mentioned at the top of our call. And you can see the words that really stand out are future, usefulness, automation, innovation, efficiency. And this is a trend that we see across all three cohorts. However, we do see these words like skepticism that pop out, doubtfulness that pop out. Is it limited? And so there are a few of these more hesitant words, doubtful words that appear particularly in the future user and skeptics cohort. And I believe we quantify this in the full report. Now, looking at AI integration in life science workflows, there are mixed sentiments. In general, respondents believe in the value of AI, but they do highlight what they're concerned about as well. So respondents were asked to indicate their agreement or disagreement with these statements. They're opposing statements on each side. So for example, the hesitancy to trust the output, or they completely trust the output. And here, the blue dots represent current users of AI, and the green dots represent future users of AI. So as we can see, based on these trust statements, future users are less likely to trust AI than current users. And they indicate that they might require more persuasion before implementing AI in their current workflows. Nevertheless, in general, though they're hesitant, they do believe that AI can deliver insights that a human cannot. They do not believe that AI will not replace the need for human involvement. So this is that persuasion aspect again. But they do understand the benefits, where AI can speed up their workflows. It can significantly assist in the tasks that humans can perform. But they understand that there's still much to learn and using it in their workflows. Looking at the perceived benefits of AI and life science research workflows, respondents identified increased data processing power, increased speed, the speed at which current tasks are being performed, time savings, and new data insights as the 4 key benefits of utilizing AI. And this pattern is echoed among future users as well, though perhaps not to the same extent. Additional benefits include increasing the scope and applications of research work, decreased costs, data fidelity, and decreasing the knowledge barriers. But these are much more secondary or even tertiary compared to the core 4, which really centers around efficiency and data insights. Nevertheless, there are several concerns that are paired with using AI in research and work. Number 1 of which is the data validity and trust in the data that's being generated from AI. Additionally, lack of organizational infrastructure to support AI, cost of implementation and upkeep, as well as cyber security are additional concerns. Similarly, concerns are kind of spanned across several different ideas. Of the secondary concerns, there aren't any that particularly stand out. Replacement of human jobs is a concern for 29% of current users, but it's still lower on the concern scale compared to some of these other sentiments. Pattern recognition, particularly digesting big data or omics-like data, modeling, predictive modeling, and pattern recognition of images are the top tasks that are currently assigned to AI, and also are tasks that respondents would like to further assign to AI. Interesting enough, natural language processing, so like ChatGPT, is not a priority for life science researchers at this moment in time. So we did look at commercial options for AI and try to explore further how researchers would like to integrate AI into their current workflows, the timelines for this integration, and also the willingness to pay for commercial solutions that are independently developed and not internally developed. And what we found is that it's very application specific. Here we looked at a few different types of core research fields, such as molecular biology, cell biology, microbiology, et cetera, and found that willingness to pay for commercial solutions is application dependent and highly of high interest for applications such as drug discovery, molecular biology, as well as analytical chemistry. In addition, for future users who are seeking to use AI to perform this task that we mentioned earlier, fields of interest include drug discovery again, but also genomics and transcriptomics, which could have active demand in the future. Nevertheless, there are a few barriers to adoption for AI. This question was posed to that skeptics cohort who do not currently plan to integrate AI in their workflows. And the reasoning behind that was that there's no direct application for AI in their research, meaning there's no custom solutions that are tailored for their needs at this point. Neither do they have enough trust in AI to generate valid data as well as span any of the other concerns that we had highlighted earlier. 11% of respondents did indicate that there were other reasonings behind these 5 that were highlighted, including lack of infrastructure, lack of understanding of AI, and just no perceived benefit. And this other cohort indicated that there are fears around AI potentially replacing human jobs in the future, lack of creativity of AI for problem solving, and just the knowledge barriers in general for implementing AI. So thank you for your attention for this webinar. These were just select highlights from the title as a whole, where we really delve into each of these topics in a little bit more deeply, as well as in a more segmented manner as we look at the key differences across market segments, across AI usage, generations, et cetera.
Great, Danny, thank you so much for that presentation. So at this time, we'll take any questions from you guys. If you want to just put those in the question chat of your attendee panel, now would be the time to do so. So we'll give everyone a minute or so to get their questions in. Okay, it doesn't look like we have anything coming in right now, but if anyone does think of any questions as a follow-up when they do receive the on-demand version of these slides, any other questions on the reports or any of other bioinformatics offerings, please don't hesitate to reach out. Danny did include an email here. It's info@bioinformatics.com, and we'll be happy to answer any of those for you. So at this time, we'll go ahead and wrap up. Like I said, as a reminder, you will receive an on-demand version of this presentation as a follow-up. Oh, it looks like we did have something come in. So Danny, can you think of a few examples of LS purpose-built vendor solutions people are buying or considering?
So we opted not to highlight it in this particular report. There are a few solutions that are available on the market. I believe respondents in general highlight that Thermo Fisher is a leader in developing these solutions, as well as Google and IBM. And a lot of these solutions are more broadly based and used for tasks that are currently being performed. So a lot of pattern recognition, a lot of data processing, and like research, it's very specific to the topic at hand.
Okay, another question that has come in, how can they buy the full report?
So I don't know if Keely wants to walk us through this process, but there certainly is a page on our website where you can purchase it. If you're a subscriber to our Knowledge Center, you'll also be able to access the report in full.
Yeah, absolutely. And when we do follow up with the on-demand presentation, everyone will get a link to the product page for that report. So there you can view more information about what's included, the full table of contents, and you can make your purchase from there. Another question that's come in, could you explain why ChatGPT is not as popular among life science researchers?
So we did ask a few different questions about natural language processors and the perceptions of AI, particularly, for example, ChatGPT. In this report, it will be in that first section of the full title. But in general, I think it's really based about the task. I think ChatGPT is incredibly topical right now, and it's really worked. Its use cases haven't yet been fully explored. I think in general, life science researchers, at least my interpretation at this point, is that they're really focused on their tasks at hand, in which case there are solutions that are more readily available. That isn't to say that future solutions may veer in that direction, and maybe perceptions will change.
Thank you. We're on a roll now with questions, Danny. So next one is, can you please tell me AI applications in the CRO industry? So I guess any examples of applications in that industry specifically.
We'll have to look directly into the data set. I don't know off the top of my mind at this point, but I do think the top applications that were highlighted include, drug discovery, drug screening, target identification, and just general research in like genomics, transcriptomics, et cetera.
Great, thank you. Next question, could you share a bit more insights you have observed regarding using AI in omics research?
So, could you repeat the question?
Sure. Could you share more insights you have observed reusing AI in omics research?
So I think though we just looked at, a variety of omics within this particular study, we didn't delve into it in today's presentation. A lot of what we saw was similar to the tasks that we highlighted. We did talk through a more specific tasks for application specific readiness, but and kind of looked at current usage as well as the interest in additional implementation of those tasks.
Thank you. So the next one that we had come in was, do people have concerns around IP?
I'm muted for a moment there. So when we looked at benefits and concerns, cybersecurity was one, but no one specifically mentioned IP. I think really what the focus was around was the trust and the idea that there might be issues with the data validity of AI at this point.
Great, thank you.
And respondents were provided the option of inputting additional concerns, and just wasn't one that was highlighted within this particular question nor in the barriers to adoption question as well.
Thank you. So next one that's come in is, could you share a bit more detail around the job titles of the people who answered the survey?
So we had a mix of different types of respondents. The top ones were lab directors, lab managers, supervisors, principal investigators, staff scientists, etc. But there were a variety of job titles that we allowed to qualify in the study.
Great. Thank you. And if anyone has any other questions, I will say for for specific questions, we are tracking all of these in the question field, and at the conclusion of the webinar, we'll also be able to follow up and provide any more specific information or answers for you guys. So just as a heads up, we will be tracking these, and we'll follow up with any more specific information that we can give you guys as well. The next question that came in is, what is the definition of AI that was used for the purposes of this study?
If I can find the exact definition. I'm not sure if we presented a specific definition other than saying artificial intelligence is the use of computer systems to simulate the human cognitive process for analysis or processing of data, such as interpretation of images, analyzing language, and identifying patterns. And then we differentiated between personal tasks and work-related tasks. And for personal tasks in particular, we did provide examples for navigation systems, search engines, and streaming service recommendations.
Great. Thank you. Okay, I think you managed to make your way through all of the questions, Danny. So at this time, we'll go ahead and wrap up for the day. So as a reminder, again, you'll get a follow-up of the on-demand recording for this presentation. Like I mentioned earlier, we are tracking all of the questions in the chat. So if we have any additional information that we can follow up with at the conclusion of this presentation, we'll do that as well. If there are any follow-up questions, like I said, that come up on the report or any other offerings that you might see across the BioInformatics website, please don't hesitate to reach out to info@bioinformatics.com, and we'll be happy to answer those for you guys. But thank you all so much for joining us today, and I hope everyone has a great rest of your day.
Thanks, everyone.
Great. Thanks, everyone.